mental health needs of the children and women in detention. I'm not a mental health expert, again, I'm just working with women and children from a child protection and rehabilitation perspective. So I see that as an external collaborator. So first, I think what I would like to start with is to really ensure that we will make the difference between women and children. Because whereas it's not the same at all. There is a specific legal framework and specific legal provision that apply to women and that apply to children. Children are less than 18 years of age. Women start from 18. And both are characterized by vulnerabilities and discrimination. And within children, you have different genders. Boys, girls, or any other gender variant identity. And what is, I think, important is to ask ourselves, since we want to talk about what happens to women and children in detention regarding their mental health, is what happens before they actually come in detention. So if we look at a study which is titled The Burden of Mental Disorders in the Eastern Mediterranean Region, there is actually 4% of women in Pakistan experience mental disorder. That's the level of the mental illness burden. Women in Pakistan lost nearly 1.2 million total DALIs to depression compared to men's. DALI is the disability allocated, what do you call that, life years. So if you calculate the representation of women in Pakistan who are mentally ill, it means that the total days or years that they face dealing with that mental illnesses represents 1.2 million. So you can imagine the cost, the social cost and the human cost of not addressing mental illness for women. The anxiety exhibits a similar gender divide, and it's more important for women than men comparatively. So that's for mental illness, for depression, and if we look at anxiety, it is slightly less, 376,700,000. In general, mental illness, is not acknowledged. It's okay, it's going to be better, but we don't really acknowledge that there might be a pathology. For children, the burden of common child mental health disorders in Pakistan is unknown, because it's usually undetected and also not acknowledged. Mushkil bacha hai, chalak hai, nakhri karte hai, tantrum karte hai, but we never try to put the glasses of the psychological, perspective. Or is badly bred, that's very easy also. The behavioral and emotional problems as well as the intellectual disabilities are usually the common health issues that children face in Pakistan. And it's stemming, and that's very important, largely from malnutrition. We have 5 million stunted children in Pakistan. The first impact of malnutrition is actually mental health, mental illness. That's very much correlated, and that's why it's a public health emergency. Consanguinity, that's also a problem. Communicable disease, and then last, but certainly not the least, the level of trauma which results from violence and abuse that have been experienced by children, basically, and that's a big issue. And in particular, child sexual abuse or exploitation. And usually there is a totally inadequate response, whenever and if ever a response. So what is the situation in prison? Well, because we talk about women and children in prison, by definition we already talk about a very vulnerable group, women, and then children in conflict with the law, which means children who usually, if you look at the offenses that are the most prevailing one for juvenile offenders ending up in prisons, it's usually linked to drug addiction or drug trafficking. A lot of is also with rape and murder. Those are the main 3 reasons. Then children who are born in prison and who live with the mother. This is also a category we have not targeted as such, that should not be forgotten. And those children are also highly vulnerable. They witness violence and abusive and extremely traumatizing situation, and they need help. There is in general no screening, no prevention, and a totally inadequate response. And when I'm saying no screening, I mean that a regular overall research-based assessment of what is the situation of those women or those children in detention, mental health. Those kind of research that you said this search should be something that the state actually conducts, so that it gives a measuring indicator to see, we're doing this right, that's the right way to go, maybe we can correct it like that. I mean, to inform the policy and the program and the investment and how we should allocate resources also. Because maybe we allocate resources where we should not, and maybe we forget things where we should invest and it would be more cost effective. There is also a problem with the environment, and you pointed it very rightly. I'll just give you an example. In Australia, they used to put Aboriginal people in the prison, and those people by nature are very much attached to an external environment, and they were actually developing extremely grave mental illnesses. And the moment they were allowed to bring plants and paint plants all around, they already felt much better. So that's an example of how you are better if you have a more conducive environment for your psychological well-being. There is a problem with staff training, a problem of treatment and services, a problem to approach. You said it very rightly. We have a very colonial mindset which was aiming to control people, not to reform them, and we need to shift from that autocratic and coercive logic. And there is also a problem in terms of lack or insufficient activities, conducive activities that reach and lead the children in particular, towards positive ways. Women are more likely to suffer mental illness than men in detention. That's about, again, based upon the overall data. If we look at your data, it's the opposite. So I don't know, we need to see. Children in detention, so I'm saying especially prison, because normally they should be in detention in rehabilitation center and not in prison. So when it is a prison-like environment, often suffer mental health disorders prior to or as a consequence of confinement and abuse. In general, confinement does not serve the purpose of feeling better from a psychological perspective. It aggravates the mental problems. I would like to really make a kind of a special chapter for special importance to be given to juveniles, but also to victims or survivors of child abuse, and especially child sexual abuse. What we need to know is that when someone is victim of child sexual abuse, there are trauma-causing factors that result from that abuse, basically. And those four main trauma-causing factors are a traumatic sexualization. You do not discover and experience sexuality in a healthy and decent and constructive manner. You have that fundamental sensation of betrayal. You have difficulties to trust the ones who were close because they hurt you. You have a problem of feeling powerless, because you went through the worst and you were not able to do anything to escape that situation. And you also have a sentiment, a feeling of stigmatization, very strong one. And that leads to 6 key kind of characteristics that would be applicable to survivors of child sexual abuse and exploitation. You basically have negative messages about personal and interpersonal worth. So that's called low self-esteem, lack of self-confidence, and that leads easily to depression. You have overwhelming emotional reaction that usually feed aggressiveness, being difficult, never being happy. You have, you remember abuse through bodily sensation. So whatever you felt during the moment where you experienced abuse, you will have a kind of sensorial, sorry, I don't know if it's English, yeah? Sensorial memory. And that can be translated, for example, into teenagers or women suddenly having big shaking moments, sessions, or perspirations. And this is punctual, and when the doctor would come, they would say, nothing is wrong. She's absolutely fine. He's absolutely fine. And then you would think, Shahid, he's faking it. Like it's actually a symptom of a real mental illness that has no physiological, manifestation other than the memory. You also have the personal narratives of abuse, which means you kind of remake the story of the history. And that's where you can have a different version of one abuse. And so you would be perceived as lying, whereas it's the overall mechanism of reconstructing and re-experiencing the trauma, which is actually leading you to not necessarily being always consistent in what you're going to say. When you want to harm someone, actually injuring yourself or injuring someone, and that can even be till suicide or killing someone else out of all this. And then you also have the link of what we call the risk of relapsing, doing it again. What is very important is that when you look at global survey, out of the total numbers of abused children or survivors of child sexual abuse, 1/3, it is estimated that 1/3 are going to become abusers themselves. So preventing abuse is actually happening already by addressing the abuse, and that's why it's very important to address mental illnesses and work on child protection. It's also important because it's a matter of human dignity and fundamental right to health. And it's for the overall societal well-being, because you don't want a society where people don't feel fine and are dangerous. Next. What to do? So I think we need to ask ourselves, I was thinking about the children, do we want women in prison when they have young children? It's the question that Pakistan is asking itself, and you're not the worst actually. You're one of the encouraging scenario of that compared to many other countries. You limit that. You don't put pregnant women in jail, for example, so you're not so bad compared to many other countries. We also need to transform the prison space for children or mothers in jail. So, for example, you can, if I take the example of Adiala jail, there are not so many children with women, but it would be very easy to make sure that you have, currently some mothers are with not mothers and children. So we need to reorganize the space and ensure that all the mothers are in one space. For example, with the children, you can have, nice colors and child-friendly environment within that space when the children are, and transform the area for where children can be educated and everything into a child-friendly structure. This is very limited cost, and that could be very effective. We also need to ensure that to train and allocate relevant staff, clinical and non-clinical. Next. And we need to work on prevention and response. Provide child-conducive activity, education, screening, mental health services provision, avoid children in detention. One of the best ways to limit mental illness among children is not to put them in jail, to start with. And that's why the new Juvenile Justice System Act is actually promoting, and what the judiciary is also trying to do, and also through establishing child courts and child protection courts. So all those efforts currently are leading towards keeping the children away from abusive situations and detention as much as possible. Child protection mechanism and interagency protocol for case management. Before putting children into dangerous situation that may put them into abusive situation and therefore generate mental illnesses and maybe make them end up in jail, we need to basically make sure that they don't experience abuse. And that means working on fighting against child sexual abuse, against corporal punishment, against child labor. That's you've seen that it has an impact on the population in terms of depression. Those are situations and issues that put children in situations that are traumatic. We need meal visit, means monitoring, evaluation and learning, and we need research. And I think I don't have any other slide. Yeah, that's it. And sorry, one very important point. When we want to solve the problem of child protection and help them in the response, we tend to go to full institutionalization of children, which basically means we create a child protection institution, which is a kind of orphanage, and we put the children there. Putting children in orphanages is the best way to ensure that they will probably be abused as well, because there is access, there is concentration, there is little monitoring, and that's the trend which happens everywhere in the world, whether it is you've seen those histories of the Christian boarding schools or whatever. It's not only about madrasa or temples, it's just concentration of children, easy access, very low monitoring. So we need to work on alternative family support mechanism. In Pakistan, it shouldn't be that complicated because you already have your joint family system and your community-based system, which you can actually use in a positive manner, and make sure that the child protection institution resembles a little family group and is used as the last resort. That's it. Thank you.